Dr. Bridget Nash, and I'd like to welcome you to The Therapy Show, a podcast series that seeks to demystify mental health treatment. Today, I'm honored to welcome licensed clinical social worker Kelly Smyth-Dent, who, along with Dr. Nacho, created the Acute Stress Syndrome Stabilization procedure and the ASSYST-Remote for telemental health. ASSYST is a mental health procedure that can be performed remotely. Having access to remote therapy during the COVID-19 pandemic is important, especially during this time of social distancing, when therapists are looking for creative ways to help their clients. Kelly, welcome to The Therapy Show.
Thank you so much for having me.
Can you start by telling us a little bit about your personal background and professional development that led to your work with the Remote Acute Stress Syndrome Stabilization procedure? Going forward, I will just use the term ASSYST when referring to this therapeutic technique.
Yes, I am a licensed clinical social worker, as you mentioned, living in the state of Nevada. I have a private practice here in person, but also online, focusing on people living with recent, present, or past prolonged adverse experiences. For example, the current coronavirus situation, with people showing post-traumatic stress disorder symptoms or anxiety or depression symptoms, which commonly come along with trauma. I utilize eye movement, desensitization, and reprocessing therapy. I'm also the CEO of Scaling Up, an organization offering trainings for mental health clinicians, humanitarian services, and we conduct research and program evaluations.
So, how would you briefly explain ASSYST to a non-professional?
So, as you mentioned, the ASSYST stands for Acute Stress Syndrome Stabilization. We offer this training and service in group formats, so large groups for rapid response interventions immediately after some sort of disaster. We also offer it in individual formats in person. And then lastly, we offer it in a remote format, which is great right now because of the social distancing. So the ASSYST is a psychophysiological and algorithmic procedure based on memory networks designed to facilitate the client's brain to process, or sometimes we say digest, the components of pathogenic or traumatic memories that are resistant to the brain's natural processing. So let me explain what that means. So pathogenic memories, also sometimes known as traumatic memories, have 8 original components. So there's the 5 senses: sounds, sights or images, touch, taste, and smell. There's also body sensations, emotions, and thoughts that happen during and after the adverse experience. So sometimes the components of those pathogenic or traumatic memories are resistant to the brain's natural processing system. So for example, the sounds of screaming during a massacre, like the one last year in Walmart in El Paso, Texas. We worked with people after that experience, and a lot of them were saying things like, I can't get the sounds of screams out of my head, or the feeling of overwhelming fear, the feeling that you might die, uncertainty or powerlessness that can be produced, for example, right now by the coronavirus experience. Those would all be considered components of the memory. So the ASSYST helps to desensitize or reduce or make smaller those resistant components and then facilitate the brain's natural processing system. So the client's brain does the healing and the client has total control during the process.
Does a therapist need specialized training in ASSYST before they begin treating clients?
Yes, we have the training available online on our website, so you can take it on demand, but we only allow trained therapists who are licensed or in the process of being licensed, and also people in a master's program, so like master's in counseling, social work, psychology, to get trained in the ASSYST-Remote.
So from your experience, what is the clinical application of ASSYST?
So the ASSYST is specially designed for people who present intense or overwhelming sensory input, body sensations, or emotions. So typically after people have experienced or are experiencing a traumatic event, they're experiencing a lot of overwhelming sensory input. So it could be like heart racing, tightness in the chest, different somatic responses. So if somebody's experiencing, let's say, some sort of anxiety symptoms, post-traumatic symptoms, depression symptoms, things like that, based on the traumatic experience that they have recently lived or are currently living. It would apply to anybody who's experiencing those symptoms in some overwhelming way to try to reduce those symptoms and make it more manageable for their brain to process it.
Are there safety concerns when working remotely with ASSYST?
So we recommend that therapists screen the client before using the ASSYST-Remote, just like they normally would. So asking questions about suicidality, hurting themselves or others, and then diagnoses from a mental health therapist like psychosis, for example. So this way the therapist can use their clinical judgment to make the most appropriate decision on if and when it would be appropriate to use the assist.
What's the average length of treatment for somebody working with an ASSYST therapist?
So, to do the assist procedure, we recommend for one isolated recent critical incident, we usually conduct about 2 1 hour sessions using the assist. So, if the therapist wants to use other treatments after the assist, therapy will last however long they want. But just using the assist procedure to reduce the components attached to that adverse experience, usually it's on average about 2 1 hour sessions.
So, what skills, habits, or tactics can clients adopt either during their sessions or in between sessions to improve the effectiveness of ASSYST?
The assist does not involve any sort of homework or anything like that to improve it. We want the client to follow the therapist's instructions and let their brain do the work. We have these beautiful brains that have the ability to process and heal organically. Sometimes they just need a little bit of help. And so we want to facilitate that brain's natural processing. So the clients don't always realize how powerful their brain is, but the therapist does if they understand how to use the assist. So we recommend that the clients trust the therapist and trust the process because we've used it many times. We're doing research on it. We know that it works. So trusting the process is the number one thing. Also, in between sessions, we recommend healthy habits such as no alcohol abuse or other substances because sometimes that can delay or hinder the brain's natural processing system. And then lastly, we recommend the client sleep if they feel tired after the session. So it's very normal to feel tired after experiencing the assist, but tired in a good way. So whether that means going to bed early or taking a nap, because sleep helps the brain's natural processing system.
What are the most common obstacles that prevent clients from seeing the full benefit of ASSYST?
Honestly, there are no obstacles. So clients experience the benefits immediately with the assist while they're in session because the symptoms decrease significantly or disappear during the procedure. So, for example, we use a scale called SUDS to rank the level of disturbance that the person feels around what they're focusing on in that moment. So, 10 would be the highest distress you can imagine, 0 would be none or neutral. So, oftentimes, with the assist, you'll find because people are very distressed when they're coming in for therapy using the assist, oftentimes their SUD's very high, 6, 7, 8, 9, 10. And oftentimes within one session, they can lower their SUD down to a 0, 1, 2, 3, 4. So if you imagine, going from, let's say, a 10 down to a 5, you're feeling significantly better by the end of session. It doesn't mean you're completely healed, but you're feeling significantly less distress and the emotions you're feeling are much more manageable. So there's really no obstacles to that.
And can you explain what SUD means?
The SUD scale stands for Subjective Unit of Distress Scale. So it's basically a scale that the client uses to help the therapist understand the level of disturbance that they're feeling in that moment.
Can you share any poignant examples of where being treated with ASSYST had a major impact in someone's life?
Yes, one of my favorite stories is a client, a man that I was working with. He was living in Africa at the time, a humanitarian worker, and he was physically assaulted and robbed by a stranger while he was there. And he was severely beaten during that time. And he sought services from me just a few weeks after the incident. When I saw him, he was experiencing flashbacks and nightmares, severe agitation, fear of not being able to go back to work. And he was living in a very remote area where it was difficult to access help. So we worked together for 2 days in a row, actually, using the ASSYST-Remote procedure about this recent incident that had just happened a few weeks prior. And then afterwards, he reported to me that his flashbacks and nightmares went away. He was able to rest and sleep through the night. He was able to think more clearly. He wasn't having obsessive thoughts and worry about it happening again or curiosities about what would happen if he kind of went back out on the streets or went out at night. just less hypervigilant in general. And then he was able to focus at work again. So it created very quick results for this person to essentially get back to life as normal.
So, Kelly, what are you most excited about in mental health treatment today?
I'm excited about a lot of things in mental health treatment, but recently I've been really excited about the move to accessing more therapy online. I have been doing a combination of therapy in person in Reno, Nevada, where I live, and then also online. And I'm finding the combination of the two is really fantastic because even for clients that live here local in Reno, some of them may feel a little bit sick and don't want to come into the office, or they might have children and are having trouble finding childcare. So they'll see me online after their children go to bed so they don't have to pay for childcare, and it becomes more affordable and accessible for them. And then I also see people that live in other countries, that live in remote areas that wouldn't be able to see people otherwise. And so I think having a mixture of options of both in person and online therapy will make mental health services more accessible and affordable for people around the world.
I agree. If you had a magic wand and could improve one thing about the mental health system, what would that be?
There's a couple things, but if I had to pick one at this moment, I would say destigmatizing mental health. I think the mental health stigma is one of the biggest barriers to accessing care. And I believe if we treated mental health the same way that we treat physical health, where people seek help when they need it and can access it when they need it, then it would have a significant positive impact on individuals' lives, their relationships, their families, and our communities on a global scale.
And what was the other one?
More affordable treatment. That one's a little bit more complicated because, therapists need to make a living and get paid for their work, and then people need to pay for it. Just like our healthcare system, it's a complicated one. But if there was a way to make it more affordable and accessible, which is the mission of our organization, then that would be my number two.
I like that. So, is there anything I didn't ask you today that you feel it is important for people to know about?
One thing that our organization works on that I think is important for people to know, it's one of our ways in which we're trying to make therapy, especially EMDR therapy, more accessible and affordable to folks, is that we train therapists how to do EMDR therapy in a group setting and to do it in a rapid response setting. And so we teach therapists how to provide EMDR in you can do them in small groups of 2, 3, 4 people in a family, or 10 to 12 people, which is pretty common. But we can also do them in very large groups with hundreds of people doing EMDR at one time. That's one of the many protocols and procedures that Dr. Nacho Jarero him and his wife have created over the last few decades, and it's incredible. So, for example, after the shooting last year in El Paso, the Walmart shooting, we went down to El Paso 2 weeks after the shooting, and we were able to provide services in a group setting. I think we served 80 people that weekend who were directly affected by that experience in the community. And then I've also provided EMDR in large groups in refugee camps with 60 and 80 kids at one time. So a lot of people don't realize that that's possible. And I like for people to know that it is, because it makes it significantly more accessible for people.
And you're really leveling the playing field here.
Totally. That's the plan.
I like it. So how can my audience learn more about your work, either online or in print?
So our website is scalingupemdr.com. So that's scalingupemdr.com. And on that site, for therapists, we have a list of upcoming trainings. And then for clients, we have a list of practitioners in various parts of the US and around the globe who are trained in these protocols and procedures. So if you're a client looking for a therapist who's trained in the ASSYST, you can find those therapists listed on our website as well.
Kelly, on behalf of myself, my listeners, and all of the people you have helped through your work, I want to thank you for your contributions to mental health treatment and for taking the time out of your busy schedule to help me and my audience better understand ASSYST.
Thank you so much for having me. It was a pleasure.
So be sure to check out my website, therapyshow.com, which has many resources about mental health, including information about ASSYST. There you will also find how to contact me to submit questions, personal stories, insights about the mental health system, suggestions about who else I can interview, or how I can improve the show. I'd like to close by reminding our listeners to please subscribe, share, and review this podcast so you, someone you love, and people around the world can gain more benefit from therapy.